Prevention in obstetrics and gynecology. Here I will talk about multiple topics and all of them are very important in AMC exam. So please keep focusing. First of all, let's talk about the steps of prevention. There are primary prevention, secondary prevention, and tertiary prevention. Let's start by primary prevention. Primary prevention is focusing on well population. And the idea of it is it prevents something from happening in the first place, like vaccine and traffic signs. The idea of it is to prevent the disease and RTA from happening. So the idea of primary prevention is to prevent the disease from happening by giving vaccine, for example, to prevent certain diseases from occurring in some population. And secondary prevention is different. Secondary prevention is focusing on population at high risk of certain disease. So it's a way of catching the disease in its early stage before symptoms start. And the best example for it is screening tools. For example, mammography that does not prevent CA breast but catch it in its early stage. Okay? And finally, tertiary prevention. Tertiary prevention, it does not prevent the disease from happening or from occurring, but trying to prevent the complications of that disease as much as it could, to make the life of the patient as normal as much as it could. So primary prevention focusing on well population, and the best example for it is vaccine. Secondary prevention is focusing on population at high risk of certain disease, and the best example is mammography, screening tools. And finally, tertiary prevention, which is focusing on prevent the complication of certain disease from occurring. So that's all related to this. Now, let's talk about some of these prevention tools that's used in a pregnancy. And these include smoking, alcohol, illegal drugs, folic acid, iron, vitamin D, vaccine. Okay, let's start by smoking. Smoking is totally contraindicated in pregnancy. Okay? And alcohol is totally contraindicated, even no 1 cup. Please, even no 1 cup is contraindicated. So not a spoon of alcohol, not everything related to alcohol. And illegal drugs are totally contraindicated in a pregnancy. Well, let's talk about the iron. I will put folic acid at the end. Iron. All women, the pregnant woman, should receive iron routinely, because the diet with iron not enough in a pregnancy, so the woman should receive iron. Vitamin D. Well, vitamin D is not given routinely to any pregnant woman unless there is an investigation that's showing that the woman suffering from deficiency of vitamin D. Otherwise, you cannot give the woman vitamin D as a routine in a pregnancy. Okay? And finally, vaccine. Well, vaccine is very important. And the most important vaccine in a pregnancy include the first one, which is the most important vaccine to be given in a pregnancy, is influenza vaccine. And the second most important vaccine is DTP. So if I asked you, what is the most important vaccine in a pregnancy, and I give you influenza vaccine and DTP, you should choose influenza vaccine because it's the first most important, and the DTP is the second most important vaccine in a pregnancy. And also keep in mind, no any live attenuated vaccine is allowed in a pregnancy. For example, MMR and others. So no live attenuated vaccine in pregnancy. Now let's talk about folic acid. Folic acid. Folic acid should be given routinely with a dose of 0.5 milligram to any pregnant woman 1 month prior to pregnancy and during the first trimester of the pregnancy. Not any time other than this, because if it's given in the second trimester or third trimester, even in high dose, it's not effective. It's only effective 1 month prior to pregnancy or more than that, and during the first trimester. And the high-risk woman should receive 5 milligram, not 0.5. 5 milligram, and these include, the high-risk woman. The first one is history of neural tube defect. So any pregnant woman with history of neural tube defect should receive 5 mg, not 0.5. The second one is woman on anti-epileptic drugs. And finally, women with diabetes. So these three women should receive 5 mg, not 0.5, in order to prevent neural tube defect. And the last topic here is neural tube defect. How to prevent neural tube defect? Simply by giving folic acid, as I said previously. And the recurrence rate of neural tube defect is 1 to 5%. And the screening should be done by using amniocentesis in order to look for alpha-fetoprotein, which is usually elevated in case of neural tube defect. So it's prevented by folic acid, 1 to 5% the recurrence rate, and the screening should be done by using amniocentesis looking for alpha-fetoprotein, which is usually elevated. So that's all what you need to know about this topic for AMC MCQ exam, which is very, very important. For full course, you can contact us through amcqbook@gmail.com. Thanks and goodbye.